Okay, let's talk a bit about ultraviolet radiation. So, not related to urticaria, completely different topic. So, UV radiation, typically from sunlight, but can also occur from tanning beds. Okay, and what does it do? Well, it damages the epidermis and the dermis, and it leads to um, potential for damage to cellular DNA. Right? So when you damage cells of the skin, you force the skin to try and repair itself through mitosis, and um, and through that process of rapid division the skin cells can make a mistake, leading to cancer. Okay, so there's damaged cellular DNA, and it also damages the proteins in the skin. Okay, so the uh, the collagen um, and the elastin gets damaged. So if you've ever seen someone with a lot of solar damage, you can see that their tissue, their skin looks very different. It looks leathery, it's wrinkled, and that's from UV radiation. Okay? It also promotes production of free radicals in the tissue, and free radicals can lead to cancer. Okay? Free radicals harm cells. So there is potential to treat, um, uh, say, UV damage or sunburns with antioxidants. And that's why some patients take vitamin E, for example, as an antioxidant, or vitamin E cream when they have a sunburn, okay, to try and limit the oxidative damage from the free radical release. It also depletes the Langerhans cells and other immune cells within the skin itself. Okay, and finally, UV radiation, not only because it depletes the Langerhans cells and other immune cells, um, but it gradually causes the skin um, to lose its ability to protect itself, leading to potential skin breakdown, fluid loss, skin infections. Okay, so UV radiation is quite damaging to the skin. Okay, so here's an image of a sunburn, which is UV radiation damage. Okay, and if there's enough of the skin involved, um, well, the patient's not only going to have very painful, tender, red, inflamed skin, which is trying to heal itself, but they often have systemic symptoms because of all the inflammation. Right? So they have systemic inflammation, fever, weakness, malaise, right? And if the burn goes deep enough, so if it's more than just a superficial red inflamed burn, it can lead to blisters, which is a deeper burn that we'll get into. Okay. And usually, if there's blister formation with a sunburn, we typically try to leave the blisters intact. We don't try to pop them or cut them open because it prevents bacteria from getting to the underlying tissue, okay? Unless the blisters are on the bottom of the feet, for example, where they just can't walk anymore. So typically we try to leave blisters intact, okay? There are some drugs that you've probably come across that can lead to photosensitivity. A perfect example of this is tetracycline, or the tetracycline drugs, sulfa drugs. They can cause the skin to be photosensitive, leading to rashes and increased sensitivity to the sun. Okay, so let's talk a bit about thermal burns. So whether it's from an open flame or from chemicals that burn the skin, or UV radiation that burns it, electrical or scalding burns, this is going to lead to injured skin, right? And when we talk about the complications of burns, um, you'll realize how important the skin is as the largest organ in the body. It's a really important organ, and when someone has extensive burns uh, to their skin, it can be life-threatening because of all the changes that occur within the body. Okay? So what can happen here? So loss of skin through burns can result in entry of microorganisms since the natural skin has been destroyed, right? So over time, it's typically not in the first day, but over days to weeks, bacteria can enter the compromised skin and set up infections such as cellulitis, or even deeper, they can spread to the bloodstream and result in sepsis, okay? So significant burns, patients can become septic. Massive fluid loss. If you remember remember all the all the reasons why we have skin and what it does. Well, it protects us from microorganisms. It also maintains our internal fluid. Okay, so when we lose significant amounts of skin through a burn, we have massive loss of body fluids, and that can lead to hemodynamic instability. Okay, hypotension, tachycardia. Because when we have a significant burn, we're not only losing fluid from the burn site, but the body triggers, with a significant burn, the body triggers all of its capillaries around the body to vasodilate. So you get vasodilation throughout the body, and you get edema throughout the body, even away from the burn. And it causes the blood vessels to be very leaky all over the body. And that's what leads to hypotension and instability of blood pressure and, of course, tachycardia. Loss of body temperature regulation. Well, the skin's heavily involved in regulating temperature. So these patients can lose tremendous amounts of heat. They're going to need treatment, not only to prevent infection and maintain body fluids, but to regulate. They will need treatment to make sure they're not becoming hypothermic. Okay? The immune system is heavily challenged because of the lack of skin and the potential for entry of bacteria. And of course, there's an incredible metabolic demand that the body is now undergoing because it's trying to heal this massive damage to the skin. Okay, so it's using a lot of energy to heal the burn. Okay, so of course it depends on the size of the burn and the extent of the burn, but when we're talking about significant burns, all of these 5 factors come into play. Okay, so let's look at in more detail burn complications. So the first one is hemodynamic instability. So we're talking about significant burns here, not a minor burn to the arm, so significant burns to the body. And what happens is, as I mentioned before, capillaries throughout the body vasodilate and become very permeable. Okay, and that's because of the intense inflammation that is now going throughout the body. Okay, so you'll get vasodilation in all capillary beds. So not only do you have a massive burn, but you're going to be edematous and swollen all over. Okay, so when your capillaries are leaky and your blood pressure drops, well, that's going to lead to pre-renal acute kidney injury because the kidneys aren't being perfused any longer. Okay, so think of this massive fluid shift out of the vascular system and into all the tissues of the body, leading to hypovolemia and pre-renal kidney injury. So that's why burn patients have significant edema all over their body, in their legs, in their lungs, all over. Okay, and that's partly why they're going to run into blood pressure issues, heart rate issues, and breathing issues as well, because there's capillaries that are leaking all the fluid into the lungs as well. Okay, the respiratory function. So this is very important as one of the initial assessments when somebody comes in with a burn, because the actual heat and also, of course, the smoke inhalation can damage the oral airway, the trachea, the lungs themselves can be damaged, and we typically assess this very quickly. So we look in their mouth, we look at their nose to see if they have singed hairs, we look to see if the back of their throat is singed or burned, and if there's any indication that there's been thermal injury to the airway, well, then they need to be intubated right away, because that's going to be swollen very quickly, and then we won't be able to intubate. Okay, so airway and respiratory function are one of the first things we need to assess. Remember, ABC, right? So we're doing airway, breathing, so that's respiratory function, and then C, hemodynamic instability. So burn patients have a hypermetabolic response that I mentioned before. Because of all this healing that has to occur to this damaged skin, they're going to need huge amounts of oxygen, glucose, amino acids to build new proteins. So, and a lot of these patients are intubated, so they can't eat, right? So sometimes they actually need tubes into their stomach to provide them with essential nutrients, and some of them may even need total parenteral nutrition, which is basically IV food. Okay, so they have this real hypermetabolic response, and then of course sepsis can occur days to weeks later. Okay, so that's always a concern because of the compromised tissue. The burn is at risk for getting infected. And on top of that, because there's fluid leaking into the lungs, and they may have also burned their lungs, and smoke inhalation, they're at risk for pneumonia. And they're likely intubated, which is a higher risk for pneumonia. Okay, UTIs, why? Likely because they have a Foley catheter in. Okay, so there's all kinds of ways that bacteria can enter into the body. Okay, the lung, the urine, the skin, the bacteria can get in and set up infection. Okay, so let's spend a bit of time classifying thermal burns. Okay, and this can be a bit confusing because classifications have changed over time. Okay, like many things, over time we find new ways of describing conditions, and burns are definitely ones that have changed over time. So let's look at this a bit. So first degree burn is basically red skin. Okay, so you've been lying out in the sun, you fell asleep, and you got a sunburn, no blisters, just red, pink, inflamed skin. Okay, so that's a first degree burn, and they're relatively minor, right? So what can we do for that? Well, we can make sure that we're moisturizing the burned, damaged skin, and often we'll use a vitamin E cream, or some people will take vitamin E tablets for a first degree burn, right, as an antioxidant. Okay, so just remember, first degree, red, pink, dry, no blisters, uncomfortable, painful, right? Okay, what about a second degree burn, or what we also call a partial thickness burn, and even more detailed, a superficial partial thickness burn. So notice in first degree we didn't mention anything in terms of partial thickness. It's just a superficial burn of the epidermis. Okay, so second degree, the first part will be superficial partial thickness. And these typically don't require surgery, and they're painful. They're blistered. They're red. They're moist because the blisters are breaking open, right? Now, typically, we let the blisters break open by themselves. We don't try to open blisters because it's protecting the underlying skin. Unless the blisters are on the bottom of the feet or on the hands and the patient can't walk because of all these huge blisters, we typically just leave them intact until they're ready to break by themselves. Okay? So that's a second degree superficial partial burn. Okay? What about a second degree deep partial thickness burn? So it's gone deeper it's gone through the epidermis and deeper into the dermis. Okay? So now, what do these look like? Well, these have, more potential for loss of sensation, for example, because the nerves potentially have been burned. There's typically kind of mottled pink, red skin. There's typically blisters as well because it's still a second degree burn. It's just gone deeper than the superficial partial thickness. Okay, so sometimes these are hard to distinguish. Second degree superficial versus second degree deep. Okay, but it's just a more significant and deeper burn. And some of these will need surgery. Okay, skin grafts because the skin's been devitalized. It's permanently damaged and scarred. Okay. So let's move on to third degree. Okay, so when we're talking about third degree burn, we call it a full thickness burn, since it also includes the subcutaneous tissue. Okay, so remember it goes epidermis, dermis, subcutaneous tissue, while third degree burns have really extended down, and typically they're dry. They have this kind of white, yellowish appearance, meaning the blood supply or the blood vessels have been burned and damaged. There's often no pain because the nerves have been burned and damaged. Okay, so these are pretty significant. These typically will need a skin graft or surgery. And remember, these are not sensitive to touch. Okay, they're not typically blistered. It's gone beyond a second degree, and that's why it's white, because the blood vessels have been burned. The nerves have been burned. Okay, so when we press them, they don't say that it hurts that much, and that's a bit concerning when a burn doesn't hurt. Okay. Fourth degree means it's gone into and burned into the bones and the muscle. So that's really a significant burn where it's charred right through the subcutaneous tissue to the muscles and bones. And we call that fourth degree. Okay, so I won't spend much time on this slide, just a summary. First degree, okay, red, painful, inflamed skin. Most of us have had it. Superficial second degree, okay, epidermis and the superficial part of the dermis, right? So a superficial partial thickness burn, blistering, painful, weeping, okay. Deep second degree burn or deep partial thickness burn, well, epidermis and deep into the dermis, right? So it might look a bit mottled. These may require surgery. There might be some blistering in it. Okay, so there might be slightly less sensation to it. Third degree, full thickness, epidermis and dermis into the subcutaneous fat. So this is where you really don't have much sensation at all. It has that waxy white appearance because of damaged blood vessels. Okay. And then finally, 4th degree into the muscles and bone, even deeper than the subcutaneous tissue. Okay, so a bit more detail on this slide, just to really consolidate the different levels of burns. So 1st degree we've spoken about. So it's that sunburn from lying out on the beach, or the sunburn on your shoulders from being out in the sun. No blisters, red, dry. It blanches when you press it because it's just inflamed, and of course it's painful. Healing time, typically less than a week. It doesn't scar, but remember, these recurrent episodes of burns will lead to skin cancer if it's from solar damage. I mean, obviously, if it's from a burn from a house, no. It wasn't UV damage, but if it's from solar damage, that's the #1 risk factor for skin cancers. Okay, so we'll go down superficial partial thickness. So that's basically another term for superficial 2nd degree. So it's gone into the dermis a bit, blistering, moist, red, very painful. Okay, and you'll see the treatments there. And then a bit more, so a deep 2nd degree burn, still some blisters, but there's reduced blanching to it. Okay, so now the blood vessels have been involved a bit, so it's not as red. Okay, there's some slight decrease in sensation to touch and to deep pressure because the nerves have been partly involved. Okay, so remember, as it goes through the dermis, it's affecting the nerves and the blood vessels to a certain extent. You can still feel it, but it's decreased sensation. The full thickness, which is 3rd degree. Okay, so now that is where epidermis, dermis, and some of the subcutaneous tissues involved. Well, they look white, leathery. They don't blanch anymore because the blood vessels have been burned away. They don't have a lot of pain to them because you've lost the nerves, so there's lack of sensation. Okay, and these may very well need skin grafting. Okay, 4th degree, even deeper. Okay, into the muscles and the bones, and these are definitely going to need surgery because that tissue is completely burned. Okay, so think of it as how deep has the burn gone, and what's in the layer where the burn has gone to. So if it's gone full thickness, such as a 3rd degree burn, right through the dermis, well, that's where your blood vessels live. That's where your nerves live, right? So you're not going to have any sensation. It's going to look white and waxy because the blood vessels have been destroyed. Okay, so let's look at some different degrees of burns. So the top left corner is a 1st degree burn, where it's red, it's inflamed. Maybe this person grabbed a pot that had a hot handle and immediately removed the hand, and notice that there's no blistering to it, so there's no 2nd degree component to this that I can see, and it's just red and inflamed. Okay, 2nd degree, well, there's redness to it. You can see the redness around the burn, and then of course there's blistering of the skin. Okay, that's typical, and that this is painful, right? And those blisters will start to weep, so pretty uncomfortable. 3rd degree, so 3rd degree looks like it doesn't have normal blood supply anymore. It looks quite charred. If you were to press that, there typically wouldn't be any sensation to it. And you can see through the kind of brownish staining on the top that it looks white and pale below. Okay, and that's because the blood vessels have also been involved. So that's the epidermis and the dermis, and a bit into the subcutaneous tissue as well. 4th degree, it's been burned right to the muscles and bone, right? So it's epidermis, dermis, subcutaneous tissue, and bone or muscle, or both. So when we talk about extent of burns, because burns can range from a minor first-degree burn to an extensive third or fourth-degree burn, okay? And the treatment is determined by how much of the body has been burned. In particular, the intravenous fluids is going to be determined by how much of the body is burned. So we need a formula to quickly determine how much of the body is burned. And by the way, we don't include first-degree burns when we're calculating how much of the body is burned. Okay, we don't really include the first degrees. It's anything after first degree. So we use something called the rule of nines. And the rule of nines just gives us a really quick way of saying, okay, 20% of the body's burned, 35% of the body's burned. So it's very quick. Okay, I'll have an image on that. And once we have the percentage of the body burned, we can then calculate how much IV fluids is required by using the Parkland formula. Okay, so really the IV flow rate is based on the size of the person, so the weight, and the extent of the burn, which we calculate using the rule of nines. Okay, so we'll come and talk. I'll show you an image on that. Whenever you're seeing someone with a burn, who comes in with a burn, always think airway, breathing, circulation. Those are key, okay? Because burn patients, even though the burns can look quite severe and you want to check the burns, that hot air and the smoke inhalation may lead to airway compromise, because they could get swelling in their mouth and their airway and lose the ability to ventilate. So we always do airway, breathing, circulation first. Okay, so the rule of nines is used for calculating the extent of burns. And so we've broken up the body here into percentages. So for example, each arm, so the front of each arm is 4.5, so each arm is 9%. Each leg, 18%. The chest and abdomen in the front, 18%. The thorax in the back, 18%, and the head, 9%. So we can quickly calculate how extensive is this burn. Let's get a percentage, so then we can go on and calculate how much IV fluids the patient needs. Okay, and that's the Parkland formula. Okay, so notice in this formula, we're taking the total body surface area that's burned. So the total percentage of the body that's burned is going to be multiplied by the patient's weight and by 4 milliliters, and that's going to be the total fluid in 24 hours. Okay, so let's just do one, because it comes out to an unbelievable amount of fluid. So let's say the person is, just for simplicity, 100 kilograms, and they've burned 40% of their body. Okay, so 100 times 40 is 4,000. 4,000 times 4 milliliters is 16,000 milliliters. That's 16 liters in 24 hours. That's a massive amount of fluid. So 16 liters in 24 hours, but the first half is over the first 8 hours. Okay, so we would give 8 liters over the first 8 hours, and we would give the remaining 8 liters over the next 16 hours. Okay, so I mean, if you think of the fact that most of us only need about 2 or 3 liters a day, this person is going to require 16 liters of IV fluids. Okay, so just understand that this is what the Parkland formula is for, is to calculate the amount of IV fluids based on the extent of the burn. Okay, so Mr. D was boiling water and the pot tipped over on him. He has painful, bright pink, fluid-filled blisters over most of his left arm and chest. Okay, how would you categorize this burn? So is it 1st degree, 2nd degree, 3rd degree, or 4th degree? Well, he's got painful, so it's not 3rd degree, because 3rd degree is usually not painful, and neither is 4th degree. And 1st degree doesn't have any blisters, so it has to be 2nd degree, right? So bright pink, painful, fluid-filled blisters. So that's a 2nd degree burn. Okay, so let's continue on with that scenario. This one's a bit artificial, this question, but we'll work through it a bit. Mr. D's burns are pink, but the rest of his body looks pale. And he has a rapid heart rate. His pulses are weak. Bowel sounds are absent. Respiration is rapid. Okay, what has caused these signs? Well, if he looks pale all over and he has a rapid heart rate and his pulses are weak, I'm thinking that, okay, now this would usually need more of an extensive burn, but I mentioned before that when you have a burn, you get a lot of inflammation, and that inflammation goes throughout the body, and it causes vasodilation of capillary beds all over the body, and that's why patients with burns swell up. They become edematous everywhere in a very short period of time. Okay, and that leads to hemodynamic instability, meaning low blood pressure, low heart rate, turning on your sympathetic system. Okay, so why does he look pale? Well, because he's likely hypotensive. Why is his heart rate fast? Because he's likely hypotensive, and his sympathetic nervous system is on because he is shifting his fluids out of his vascular space. Okay, why are his pulses weak? Well, again, because of decreased vascular volume, so weak pulses. Why are his bowel sounds absent? Well, they're absent because the body's had a massive shock and the bowel actually turns off. It stops with peristalsis and movement of food and fluids through the bowel. It stops functioning when the body has a massive stress. Okay, and that term is called paralytic ileus. If you haven't heard it before, don't worry, you'll hear about it next semester. Okay, but basically the bowel shuts off. Okay, so what has caused these signs? Fluid loss. Okay, so fluid loss not necessarily through the burn, but you will lose fluid there too, but fluid loss throughout all the body within. Okay, so it's fluid loss out of the vascular space that has led to this. Okay, so that's it for the voiceover. Less than 2 hours and 30 minutes. And I hope you all do well on your final exam. There will likely be a final exam review to help you out. So use the PowerPoints, use the voiceovers as your resource to then do well on your final exam. Okay, bye-bye.